Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bish, BDS by degree and a pharma professional. As a founder of Career in Pharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey.
Hello everyone, once again I welcome you all to Career in Pharma and welcome to another episode of important interview question answer series for pharmacovigilance. Now in today's video we are going to talk about what are different type of reports in pharmacovigilance. So again this is very common question the interviewer may ask you, asking what do you understand by report in pharmacovigilance, what are different type of reports. Yes, so let's begin with this video. So broadly speaking, see first of all what are the different type of reports. Let me tell you what report means. Report, you can assume that report is like a patient coming to you. Now if you are into clinical practice, if you are a doctor, you know that any patient is coming to you live, explaining all your his or her symptoms, explaining about whatever problem the patient is undergoing, right? So there what you do, you ask patient further details. You take patient's medical history, surgical history and whatever history is required in that case, right? So in short, you take all the details from the patient before you give some diagnosis, right? That is which you do in clinicals. But in pharmacovigilance, report means any patient report coming to you. So please understand, in pharmacovigilance, you need not to see the patient live. Patient, you can assume that patient is coming to you in the form of report, in the form of data that we call as patient report or just report inside pharmacovigilance. So the similar kind of report data which you collect in your clinical, same kind of data will be there in this report, that is in pharmacovigilance reports. So what it will consider, I mean what information this report will be having. It will be having patient demographics, it will be having patient details like surgical history, medical history, drug history, any allergy, and detail on what adverse event happened to the patient after taking the drug, what kind of adverse event it was, seriousness, severity of the adverse event, what the patient did to treat that adverse event, is that adverse event was serious. So many details will be there in this report. And also whenever any report is coming to you initially, that we call as initial report or first report, and if you feel that any information is missing, you can always ask for follow-up information to the source from where the report is coming to you. Okay, so let's understand what are the different type of reports. See, broadly speaking, inside pharmacovigilance there are two terms. One is ICSR, other is aggregate report. So ICSR means individual case safety report, means it's a report of a single patient, means a single patient data will be there in ICSR, that is individual case safety report. It will contains all the data information about an individual patient. Okay, for example, if there is my report like Neema Bish patient and all my demographics, my surgical, medical, all the history will be coming to you, and if you feel that to come up to some conclusion, some information is missing, you can ask for follow-up information. So that is single patient report that we call as ICSR. Other is aggregate. Aggregate means compilation of all the ICSR. So aggregate is not a single patient report, is a compilation of aggregation of multiple ICSR, that is aggregate report inside pharmacovigilance. Yes, so broadly speaking, one is ICSR, other is aggregate. Other kind of reports you can say, one is initial report, other is follow-up. Means initial means the first information which is coming to you. Follow-up means if any follow-up information you requires to make a conclusion, then you can ask, or patient himself or herself is sending some follow-up information to the initial report, so that is follow-up report, right? So this is depending on whether it's a first information or followed by first information, other informations are coming, those will be follow-up, right? Now, other than this, what are the different type of reports is? First, we have solicited, then we have unsolicited, then we have literature report, then we have aggregate reports, right? So these are 4 kind of reports inside pharmacovigilance. So first I will tell you what is solicited reports. See, solicited means anything which is formal, right? Formal or organized, right? That is very basic meaning of solicited. It means formal, organized way. So any report which is coming to you through a organized data collection system. Now, from which medium we can collect the data through an organized system is, it can include clinical trials. We all know clinical trials are very well designed, prepared, right? And it is a very typical organized data collection system, that is clinical trial. Or it could be some non-interventional studies that we call as observational. Non-interventional means where we are not giving any intervention, where we are not giving any medicine. We are just observing the patients, how they are going, right? So that is non-interventional studies or observational. These are also one form of organized data collection system. Then we have many kind of registries where we do organized data collections. Then we have many post-marketing surveillance studies like patient use program, yes, patient support programs, some disease management programs, some kind of survey of patients or healthcare professionals, and some kind of compassionate use. So all these use is something which is not coming randomly. We are planning it, we are organizing it, and then we are collecting the data. So solicited report means any report which is coming through a organized data collection system. Now example, I already told you, organized collection system could be clinical trial, registry, individual patient program, observational studies, right? So this is solicited reports. Now opposite of solicited is unsolicited. Unsolicited means anything which is not planned, which is not organized. So if it is not planned, if it is not organized, then it will be a random report, right? So any report which is coming to you through any unorganized data collection system, you can say they are coming spontaneously, they are coming randomly. So that's why unsolicited reports are also called as spontaneous report, and they are random in nature. And mostly these kind of spontaneous reports you may get through patient itself, or you may get through some physician, some healthcare professionals who is treating his or her patient, right? Let's say I am a patient. I took some, for example, if I took some XYZ company drug and I had some pimple. So I randomly check out the leaflet of the drug. I just found the toll-free number, some complaint care number. I just call there and call them that, hey, look, I got this pimple after taking your drug. Like that I will do, and this will be a random report. This will be an unsolicited report because no one is telling to me to do this. There is no organized system, there is no planning. I just did it randomly. So it is a random report, unsolicited report, or a spontaneous report. So these kind of reports totally depends on the voluntary reporting of the events by patient or healthcare professionals. Patient, we can say patients, consumer also. So they are voluntarily given by the healthcare professionals treating their patients, or a consumer who is directly consuming this drug. Yes, so this is also known as a spontaneous report. Third kind of report is literature report. So I hope you all know what literature means, right? So the medical literature is also a significant source of information for monitoring of safety profile of any drug and risk benefit balance of medicinal products, particularly in relation to the detection of new safety signals or emerging safety issues. So in short, any report which is coming to you through some literature article. So let's say any literature article came to you where you found that, where the company found that after taking their product the patient had some adverse event, so they will send it to you. So that will be a literature source. So any report coming through literature source will be a literature report. Now in this literature report, let's say if it's not a full text article also, if simply it's an abstract, that also we will consider as a literature report, because whenever we get any adverse event information through abstract also, we always ask for follow-up to complete that abstract to get the full citation and full literature. But even abstract also will be a kind of literature article. Yes. And last but not the least is aggregate report. Like I already explained, broadly we have, one is ICSR, where we get a individual case patient report. Aggregate refers to multiple report, compilation of ICSR. So aggregate reports not focus so much on individual case safety report, but rather they give an overview and assessment of the safety profile and helps in benefit risk evaluation. Yes. So this is the 4 kind of reports. These are the different type of reports. Now let's say if anyone asks you what are the different type of reports inside pharmacovigilance, you have to give this answer. Don't say initial, follow-up, ICSR or aggregate. That I just gave you for understanding purpose, right? Broadly you have to tell them there are 4 type of reports inside pharmacovigilance. That is solicited, unsolicited, aggregate report and literature report. Now inside this aggregate report is like aggregate. Literature report again could be ICSR also, could be compilation of multiple ICSR also, because we never know in a single literature article there are how many patients took the drug. Maybe it is talking about a single patient, maybe it is talking about a cohort. So depending on what the information that report is having, you will tell it as an individual report or multiple reports. Yes. So that's all about what are the different type of reports inside pharmacovigilance. Don't forget this information, which is a very important interview question. Yes. So that's all about different type of reports inside pharmacovigilance, and I hope you got a clear cut idea, and I hope there is no confusion. But still, if any confusion is there, please drop a message to us in the comment box below, and I would love to read all the comments, and I would love to reply each and every comment from you. Yes. So that's all on type of reports inside pharmacovigilance. Will be coming soon with some next video. So till the time I come again, till that time please stay safe, aware, healthy and updated. And forget to tell you that don't forget to hit a like button, share our channel to your friends, your colleagues, and also don't forget to subscribe to our channel. Have a nice day. Bye bye.